continuing on, we're going to talk about the lower respiratory tract. So the upper respiratory tract ends at the larynx. So moving on, the trachea. The trachea consists of C-shaped rings of cartilage. And here's one of those rings that I've outlined. The reason why it's C-shaped is to allow us to swallow food down the esophagus in the backside of the trachea. So your trachea is right in the front of your throat. So if you feel the front of your throat, you're going to feel all the bumpy ridges of these C-shaped rings of cartilage. In the back of the trachea is the esophagus. And the esophagus is where food is going to go down through for part of your digestive tract. While you're swallowing, that food needs to be able to push in a little bit on your trachea so that it can get past the back there. So we have these C-shaped rings of cartilage instead of perfect circular rings to allow for the posterior portion of the trachea to bow in to allow for the movement of food through it. The function of the trachea is this is your windpipe. If collapsed, it will prevent respiration. From the trachea, it branches to the bronchi, the secondary bronchi, bronchioles, alveolar ducts, and eventually the alveoli. And this is a diagram of the entire respiratory tree. So you can see the trachea branching to the primary bronchi, eventually secondary bronchi, tertiary bronchi, bronchioles, alveolar ducts, and down to the alveoli. Air remains in the inside of all of these branches. As we bring air into the lungs and fill up our lungs with air, these branches are just going to extend open a little bit. But the air is actually not going to seep out of these, it's just going to remain inside of these branches. So the alveoli are the primary site for gas exchange, and they help make up the respiratory membrane. The respiratory membrane is the site of gas exchange. It consists of the alveolar epithelium, which is one layer thick. It's the simple squamous epithelium. And then the capillary endothelium, again, one layer thick of that simple squamous epithelium. Excuse me. And their joint basement membranes. Then you have surfactant. Surfactant is a type of fluid that lubricates the alveoli. Imagine a wet paper towel. Now imagine stretching out that wet paper towel and blowing through it. If that wet paper towel were to become dry and you're still applying that same amount of pressure, eventually it'll become weak and it'll just rip. Surfactant is kind of like a mucus-like slippery substance that we put on the surface of our alveoli, and that prevents the alveoli from drying out and breaking open as it's filling up with air. So this is a picture of the alveolar duct that leads down to the alveolus. And here you can see the blood vessels right up against the wall of the alveolus. The alveolus is one layer thick, and so is the blood vessel. And oxygen is going to diffuse into the blood, while carbon dioxide diffuses out of the blood. And there's different viewpoints for you to take a look at how that happens. The respiratory zone includes the respiratory bronchioles, alveolar ducts, and alveolar sacs. About 300 million alveoli account for most of the lung's volume, and that is the main site for gas exchange. Most of these are just other kind of pictures or viewpoints of the alveoli so that you can understand what they really look like. So air comes in the inside of these things, and then the gases are exchanged across the capillaries that are surrounding each and every alveolus. We have two lungs. The lungs are cone-shaped organs, and they extend from the diaphragm to above the clavicles. The hilum is talking about the entry point for the bronchi. So that's the center or the medial aspect of the lung, and that's where the bronchi enter. The base of the lung sits on the diaphragm, and the costal surface is up against the rib cage. So here you can see the hilum is where the bronchi enter. The base is the bottom of each lung, and that's what sits on the diaphragm. And then the costal surface is up against the rib cage. The left lung and right lung have different numbers of lobes. The left lung has 2 lobes, the superior and inferior lobe, while the right lung has 3 lobes, superior, middle, and inferior lobe. Let's think about why that is for a minute. If you think about our heart sits directly underneath the sternum, but because the left side of the heart has to pump blood to the rest of the body, the left muscle of the heart is thicker. And that's going to extend out into the left side of the chest cavity a little bit farther, and kind of in an evolutionary standpoint, we've evolved to have 1 less lobe on our left lung. So again, the left lung is divided into 2 lobes, while the right lung is divided into 3 lobes, and their major function is air distribution and gas exchange. The thoracic cavity has 3 divisions that are divided by the pleura. The pleural divisions, the part that are occupied by the lungs, you have the left pleural cavity and the right pleural cavity. And then in the center, you have the mediastinum. The mediastinum has this kind of subcavity known as the pericardial cavity. Pericardial is around the heart, while there's the esophagus, trachea, large blood vessels that make up the other part of the mediastinum. The thorax or thoracic cavity's job is to bring about inspiration or breathing in and expiration or breathing out. This is a picture of a cross-section of the thoracic cavity. So you can see how the right lung is completely enclosed and the left lung is completely enclosed by these pleural cavities.